Being a provider in Kapuskasing, a predominantly francophone community, obviously the services are all fairly available in French. I could say that maybe in the emergency department you won't always encounter a francophone physician, as we staff with out-of-town locums, but at least there's always a nurse or a staff around who can help translate. As a doctor, my job is not only to write prescriptions. The most value that I can offer my patients is the medical advice that I give, and if they can't understand it, then I've not done my job at all. It's important for the patient to feel that they are a part of the decision-making process. We're partners in care. It's not a unilateral decision-making. It's supposed to be done in collaboration with the patient. So I need them to understand all the risks and benefits of treatment and understand where we're going so they can make an informed decision. A story that I hear all too often is the story of the little madame who went out of town for an appointment to see a specialist, and she comes back to me for follow-up and asks me what the specialist said, and I'm quite confused because she's the one who attended this appointment, but clearly she hasn't understood anything. And Madame has been started on a medication by the specialist and she doesn't understand what for. She's even signed a consent for an operation and she doesn't understand the details of the operation. So in a case like this, the doctor has not done their job because the patient does not understand the risks and benefits of the treatment that they are receiving or about to receive. So I'm currently in the midst of developing a list of francophone providers in the region. And I shouldn't just say the region because it would extend all the way out to Ottawa, because that's how far sometimes we have to go to get services in French. So my goal is to have different referral points for every patient. You need to see a urologist, let's say. You can go to Timmins and see the English-speaking urologist, or if you travel a bit further to Sudbury, maybe you can see the French-speaking urologist, and leave that choice up to the patient. Maybe they're completely fine and they can get by with that English specialist, but maybe it's very important to them and they want to communicate and be part of the decision-making process, and maybe Sudbury would be more appropriate referral for them. The active offer only works if we actually have the services available. That being said, we have to take into consideration and keep in mind that a lot of our francophone patients do not feel comfortable asking for services in French, and by actively offering them these services, we are giving the power back to them to say, yes, I do want services in French, thank you. Yes, I want to be part of the decision making regarding my own health. And yes, I choose to have equitable health with my Anglophone counterparts. I think that this is very important, and obviously if the patient feels more in control of their health care decision making, that they're going to be more satisfied.